This is ASCRS ASOA Today. Here we go. The 2014 ASCRS ASOA Annual Symposium and Congress is officially underway. We are so glad that you are able to join us here in Boston as we once again gather to learn, connect, share, and deepen our knowledge of the ever-changing world of ophthalmology. The next 4 days, more than 1,200 speakers and presenters will be focusing on the latest techniques, technologies, research, innovation, and inspiration for anterior segment eye surgeons, ophthalmic practice administrators, nurses and technicians, and just about everyone associated with the world of cataract and refractive surgery. Over the next 4 days, this program will bring you behind the scenes of the meeting and many of its important programs. We will also take a closer look at the ASCRS clinical committees and the work they do year-round to make the ASCRS ASOA Annual Symposium and Congress so unique in its diversity, quality of education, and intensity of choices.
The lifeblood of ASCRS are our clinical committees. In these committees, leading experts in the field of cataract, glaucoma, refractive, etc., develop protocols and look at new technologies and look for unmet needs in ophthalmology. These committees meet on a regular basis. They converse constantly. We're having telephone conferences. They produce white papers. They produce informative symposia that we hold at ASCRS and at our winter meeting, and they write extensive reviews. Every now and then we'll have a clinical alert that will come from an ASCRS clinical committee that needs to be received on a timely basis by our membership. These clinical committees really provide the foundation for what ASCRS is, and this is where the leadership of ASCRS starts. You start at the clinical committees and then you work your way up, and every single president at ASCRS has been a member of a clinical committee prior to assuming the role of presidents. My hat is off to the clinical committees. They're doing a better job than ever before, and they will continue doing that because we have great leadership right now in place, and it's just very exciting to see the vibrancy and passion of these clinical committee members.
We will hear more about the ASCRS clinical committees and their work as the week goes on, but we will get things started with the traditional opening general session, a must-see event that highlights some of the most important thought leaders in the history of ophthalmology. ASOA will also open its session with an inspirational kickoff to its annual program. Here are a few of the highlights of the Saturday ASCRS and ASOA opening general sessions. This is ASCRS ASOA Today.
In laser vision surgery, is it better to be fast or slow?
Fast! A fast procedure helps control the environment, makes patients comfortable, and gets good outcomes.
I guess if you do those three things, patients will love you.
Well, in Cohen's case, they don't. Really, London? It's almost like I don't have feelings.
Looks like Cohen needs a hug.
It's not complicated. Only the Wavelight has the fastest laser platform in the US. Everybody cool here? Visit the Alcon booth for more information.
Give in to peer pressure. Learn why corneal biomechanics matter with Reichert Technologies.
I want to help.
I want to help.
I want to make a difference.
I want to be able to look my patients in the eye and say, we can do that.
We can do that. Yeah, we can do that.
I can help you.
I know that my training counts.
4 years of medical school.
9 years of surgical training.
Rigorous residency training, fellowship.
I want freedom.
I want to innovate.
I want to collaborate.
I want to focus on patient wellness.
I don't want red tape.
I want to feel that passion again.
I want to put health back in healthcare.
Visit our booth to learn more about Alphion and discover the freedom to practice as you please.
This year, as every year at the annual meeting, ASCRS will welcome a new president, tasked with the responsibility to meet the growing challenges that face ophthalmologists and medicine in general. The ASCRS president's one-year term promises to be a full one. The new 2014 to 2015 ASCRS president is Dr. Richard Lewis, a practicing physician and partner at Grootsmacher, Lewis, and Sierra Surgical Eye Specialists in Sacramento, California. The former director of glaucoma at the University of California, Davis, Dr. Lewis has lectured extensively on glaucoma and cataract surgery and is actively involved in clinical research in glaucoma therapy. He follows outgoing president Dr. Eric Donenfeld.
As president of ASCRS, it's been a whirlwind year. I wake up in the morning sometimes and I pinch myself and I say, is this real? Being president of ASCRS means that I get to interact with leading ophthalmologists from around the country, but even more importantly, I work with a dedicated staff at ASCRS every day trying to make ophthalmology a better place for all of us. And if I've played a small role in making ophthalmology better, I think I've had a very successful year, but I owe it all to the dedicated doctors and the team of people at ASCRS who work on a daily basis with me. It's been an extraordinary year and one that I will cherish forever.
We're all very excited that Rick Lewis is coming in as president of ASCRS. Eric Donenfeld's done an awesome job this year as president, but one of the things that the executive committee and governing body strive for in the leadership is to make sure that we have a ongoing sequencing of different subspecialty interests as well, so that all the subspecialties are well represented. And the timing of Rick coming on as president is particularly fortuitous because MIGS, the microincisional glaucoma surgery, is one of the hottest subjects right now, and Rick is one of the leaders as a glaucoma subspecialist and investigator in those areas. So there's nobody better positioned to make sure that education in MIGS is at the forefront of the program. And so there's, I was going to say enormous number, but it's proportionately enormous number of presentations on MIGS to enable cataract surgeons who have really not thought of themselves as glaucoma specialists now be able to take advantage of these new technologies and learn both the indications, the potential problems, and then the techniques as well. So that, I suspect, will probably be right there with toric IOL's issues as the two biggest interest areas at this year's meeting.
Glaucoma is a very prevalent disease for all ophthalmologists. It probably represents the most common disease across specialties because every patient is at risk in their disease process of acquiring or getting glaucoma. And it's incumbent upon all of us to stay up to date on the diagnosis of the disease, of the treatment options available. And what's interesting now is that these diagnostic and surgical approaches are so much better. We're able to diagnose glaucoma earlier, we're able to treat it more effectively, we're able to get patients off medications, and some of the problems that older therapies were causing, we can now avoid. So despite your specialty, whether it's cataract surgery or corneal treatment, corneal disease, glaucoma is still there, and everyone recognizes that, and so now there's much more interest. The ability now to offer these simple treatments makes it a unique time in glaucoma.
This is ASCRS ASOA Today.
Coast to coast, dusk to dawn.
SightPath is on the move.
Mile after mile, all year long.
SightPath is on the move.
Our 200 employees travel 3 million miles a year
to help our customers provide quality care
close to home.
All we do is eyes.
All day, every day.
Every day.
Join the movement.
Do not miss Friday night. The Abbott Symposium is going to be something extraordinary and special, something you'll be talking about for weeks after you attend. Friday night, Boston, Abbott event, be there.
How much risk can you afford? Does the potential of $1.5 million in HIPAA violation fines and jail time keep you up at night? Visit booth 2121 and speak with the compliance and EMR experts at Gibraltar IT.
We hope you packed your running shoes for Sunday morning as we get ready for the second annual ASCRS Foundation Run for Sight. All proceeds from the 5-kilometer, 1-mile walk, which is sponsored by Tear Lab, will go to benefit the ASCRS Foundation and its important work in humanitarian eye care.
Hi, I'm Edward Holland. Please join us for Pardon the Ophthalmology. My co-host, Dr. Terry Kim, could not be with me today, but we have him live via satellite. Terry, can you hear us?
Hello, Ed? Ed, this is Terry. Yes, I can hear you. I'm so sorry I can't be with you today. As you can see, I'm at a very important meeting.
PTO is a fantastic event, Terry. Some say even on par with the greatest sporting events. What great events have you been to?
When you mentioned the greatest sporting venues, of course I've been to the Olympics in Sochi.
Any others?
Well, yes. I've also been to the Super Bowl.
Well, where else have you been?
Well, how can we forget the Final Four that was in Dallas, Texas? That was a lot of fun.
But Terry, what's the main attraction of the upcoming ASCRS annual meeting in Boston?
I think the main attraction is going to be our PTO Symposium on hot topics in cornea and external disease. That will take place on Sunday, April 27, from 3 to 4:30 p.m. in the Grand Ballroom of the Boston Convention Center. And I think it's going to be a lot of fun.
Thank you, Terry. Your dedication to ophthalmology and education is inspiring. My only advice, Terry, is maybe to take a little time off from that busy work schedule and try to have a little fun. I think you might enjoy it. Please join us at the ASCRS Pardon the Ophthalmology program at the upcoming meeting in Boston. I hope to see you there.
This is ASCRS ASOA Today.
I want to help.
I want to help.
I want to make a difference.
I want to be able to look my patients in the eye and say, we can do that.
We can do that. Yeah, we can do that.
I can help you.
I know that my training counts.
4 years of medical school.
9 years of surgical training.
Rigorous residency training, fellowship.
I want freedom.
I want to innovate.
I want to collaborate.
I want to focus on patient wellness.
I don't want red tape.
I want to feel that passion again.
I want to put health back in healthcare.
Visit our booth to learn more about Alphion and discover the freedom to practice as you please.
Give in to peer pressure. Learn why corneal biomechanics matter with Reichert Technologies.
When it comes to laser vision surgery, is it better to have technology that does more or less?
More!
Why?
Patients come with all kinds of conditions and problems that need to be fixed.
Yeah, technology has to be designed so you can get more options.
Options? Like what?
Well, when I'm on a bike, I can fly up in the air when I go on rocks.
Huh.
Like a boat. If you want to float, get on a boat.
You're a poet and you didn't know it.
What?
It's not complicated. Only the WaveLight laser platform has the broadest range of treatment options in the US. You guys like options, right? Visit the Alcon booth for more information.
Advances in glaucoma treatment are top of mind this year. Dr. Ike Ahmed, a well-known glaucoma specialist, will deliver the prestigious annual Binkhorst Lecture. Since 1975, the Binkhorst Medal has been awarded to the world's most prominent ophthalmologists whose careers have made significant contributions to the science and practice of ophthalmology. During his distinguished career, Dr. Ahmed's work has established him as a foremost leader in the field of ophthalmology and a primary force in the study and understanding of glaucoma treatment.
The Binkhorst Lecture is the premier lecture of the annual meeting, and the speakers are very, very carefully chosen. It's a tremendous honor to be given that title as a Binkhorst Lecturer. It's given at the conclusion of the opening ceremonies, and it represents the pinnacle of what ASCRS membership is all about, because that lecturer has earned the tremendous honor having done great research and clinical application for eye disease. So I'm sure that Ike Ahmed will do an outstanding job in honoring that tradition.
This is ASCRS ASOA Today.
Do not miss Friday night. The Abbott Symposium is going to be something extraordinary and special, something you'll be talking about for weeks after you attend. Friday night, Boston, Abbott event, be there.
Viz Optics is introducing two devices that, for the first time, measure vision under conditions that mimic real-world activities, the Central Vision Analyzer and OmniField. Visit booth 2121 for retest reliability like never before.
Coast to coast, dusk to dawn.
SightPath is on the move.
Mile after mile, all year long.
SightPath is on the move.
Our 200 employees travel 3 million miles a year
To help our customers provide quality care
Close to home.
All we do is eyes,
all day, every day.
every day.
Join the movement.
What's something that's big that you wish were smaller?
Well, my dog. He's gained a few pounds over the years.
Well, I was thinking more along the lines of laser refractive surgery.
Some laser platforms are large. They take up too much space and they're not keeping up with today's changing requirements.
Changes? Like what?
Like smaller, state-of-the-art technology designs, which help utilize the facility space more efficiently.
That's interesting. Anything else?
Don't forget about the integration that helps reduce potential errors and keeps the data accessible.
Is he supposed to be here?
I don't think so. It's not complicated. Only the Wavelight has a small, ergonomically designed footprint with an integrative data network. Visit the Alcon booth for more information.
In addition to the annual ASCRS Glaucoma Day, held each year in conjunction with the ASCRS Symposium, there are many sessions and presentations over the course of the meeting that will appeal to those wanting to learn more about glaucoma treatment.
It's very interesting when I travel around the country and I give visiting lectures at different places, and one of the consistent things I hear from general ophthalmologists is that they're surprised by how much glaucoma they're actually doing. Many of my colleagues who are general ophthalmologists are describing that 30 to 40% of their practice has become glaucoma. And you know, these are not glaucoma specialists per se, but so there's very high interest in glaucoma now among really all ophthalmologists, and it's not going to be the academic glaucoma specialist, fellowship-trained glaucoma specialist like me, who's going to be in the trenches managing all of the first-line glaucoma. They usually come to me when it's time for surgery or there's some kind of diagnostic dilemma. It's really the general ophthalmologist that really needs to be on the front line, not just with medical treatment and laser treatment, but now I think with the advent of MIGS, it's going to be some of the earlier surgical treatment as well, which I think is which to me is very exciting.